everyone, welcome back to our channel. It is a cold day outside here in Austin. We're actually recording all these videos in one day, but it looks like I'm about to go skiing.
Yeah.
Looks like you're not about to go skiing.
No, I would freeze if I tried in this, so I would not give that a shot.
I'm just always cold, so bundled up over here. But anyways, welcome back to our channel. Today we are going to talk about FTD, also known as frontotemporal dementia.
So FTD, or as you said, frontotemporal dementia, is a semi-common neurodegenerative disease. There are different types. It used to be called Pick's disease. That may be a term that some people are familiar with. Yeah. But and we still use that sometimes, but it's sort of coming out of favor a little bit. The terms frontotemporal speak to the parts of the brain that are mostly involved, so the frontal lobes or the temporal lobes behind the ears. And the symptoms that are associated with each of these, what we call variants of FTD, are related to where the disease symptoms begin. So we know that the frontal lobes are very important for behavior, for planning and problem solving, for executive functioning. And so people who have the frontal form of FTD, we call this the behavioral variant of FTD, will often have very early changes in behavior. They may become disinhibited, have inappropriate behavior in public, agitation, aggression. Again, significant changes in personality before language, generally speaking.
Now, are these symptoms that one might first notice whenever they're experiencing this type of dementia?
Sometimes the patients will notice it early on, and they probably will. They may not mention these changes. Family members often will see these changes early too.
Okay. And what would you say, I know that this is different than Alzheimer's, obviously, but typical age of onset, what do you typically see when people come into your office that are diagnosed with frontotemporal dementia?
So FTD generally begins earlier than Alzheimer's disease does, although there are plenty of people who have early onset Alzheimer's disease. But we do think of FTD as more generally speaking, an earlier person's disease. And it can start in the 30s through 50s. It depends especially on if there's a genetic cause. I find that some of these genetic variants begin on the earlier side of things. Language form of FTD, of which there are several types. There is what we call logopenic FTD or semantic variant FTD, and progressive non-fluent aphasia. And these are both what we'll call language forms, and they therefore begin with more of a language problem prior to developing some of the behavior changes. Unfortunately, as these diseases progress, as the pathology spreads from one lobe to the other lobe, language may start first, but behaviors will often be involved later, and vice versa. Sometimes behaviors begin first, and then language starts to slip as well.
So tell us, Dr. Bertelson, is this type of dementia difficult to diagnose compared to other types?
It depends. It can be. Sometimes the brain MRI will show some very classic changes, and if that happens, there may be little debate as to what's going on. But sure, it's difficult, especially when the symptoms are more behavior-based, because there are many reasons that we can change how we act. We may get depressed, or there may be hormonal change. There may be a life stressor that changes on how we interact and how we feel. There may be a tumor, there may be a stroke. So it can be difficult, especially when the changes with behavior in the beginning are very subtle.
Yeah, so other symptoms can mimic frontotemporal dementia. So it's important to obviously see your doctor, get a correct diagnosis.
Right, other conditions can definitely mimic FTD, and it's so much in the brain it depends on location, sort of like real estate.
Yeah.
So if the lesion, we call that, is here, that may cause similar changes, whether the lesion's from a tumor, from a stroke, or a degenerative disease.
How would you distinguish this type of dementia versus Alzheimer's? What are some things that you might notice in someone that has this versus Alzheimer's?
Right, so Alzheimer's disease generally is more of a memory-based disorder. Now, we do know that people can have behavioral forms of Alzheimer's, language forms of Alzheimer's, and even visual forms. But usually Alzheimer's affects memory, short-term memory, more than anything else. But if it is a case where there may be behavior changes that can occur with either one, then testing is so important.
Yes.
Brain MRI might help distinguish, a PET scan might help, and ultimately we might consider spinal tap to look for proteins in the brain that are associated with Alzheimer's disease. If there's a family history, we might be able to look for genetic markers that are seen with one or the other. So there are some ways that we can distinguish if the clinical symptoms are significantly overlapping. So frontotemporal dementia can be associated with other conditions, especially the genetic forms. For example, the last person that I saw in whom we had this confirmed, his mother had Lou Gehrig's disease. And so, and she unfortunately passed away from that. 20 years later or so, he developed language changes, and he was found to have a gene mutation that she likely had as well that can cause both. And so the family pattern can be very helpful to rule in or to at least suspect a condition if certain diseases run in the family. So by now we've discussed a number of different types of dementia. We've talked about FTD, Lewy body disease, Alzheimer's disease, and even one of the rare forms of dementia, one of the prion diseases. And so we're looking forward in the next video or so to start talking about how to help manage symptoms, because in the end, while it is important to know what disease is happening for counseling for the patient and the family, some of the support opportunities that Mary and other therapists can offer are sometimes relatively independent of the disease. I'm sure you've got strategies that you might use regardless of what the pathology is. If there's a symptom that's going on, you can use some of these tricks to help this symptom regardless of the underlying pathology.
Of course, yeah. I'm excited to get into those videos and talk about that. Well, thank y'all for tuning in. And if you did like this video, make sure that y'all click the like button and subscribe to our channel. Thanks. Have a good day.
Thank you.